Hello everyone, I am Sarah and welcome to our channel. First, we would like to thank all our family members who subscribe to this channel and those who are going to subscribe. Thank you so much. Many people do not know what is the cumulative blood sugar test known as HbA1c test. Can you tell us what it is and what the difference between it and the daily test?
Thank you, Sarah. Thank you so much. Glad to see you again after so long. Allow me, before I answer your question, to thank our family members, those who joined this channel, and those who are going to join soon. The question is, what is cumulative blood sugar test? What is it? Before we answer this question, I would like people to know first about the component or the composition of the blood, what it is, what is in the blood. We have red cells, white cells, and plates or platelets, which altogether 45% of the blood. And we have 55% of plasma. Plasma, which is the liquid that these cells and plates are floating in. Now, the daily test, when we test every day, the daily test only tell us how much glucose is in the plasma, floating in the plasma itself. This is the daily test, and it also tells us when. Now, 5 seconds after we take the test, it tells us that now the sugar or the glucose in your blood is so and so, 95, 110, 120, 170. It depends on your glucose level. The HbA1c test is different. It tells us how much sugar stuck inside the red cell. And 1 cubic millimeter of our blood contains between 4.8 to 5 million plus of the red cells. Each red cell contains millions of hemoglobin molecule, which carries oxygen to all parts of our body. Why do we call it HbA1c test? Because we have hemoglobin A1A, A1B, A1C. A1A and A1B also, the sugar can stick to them, but more into the A1C. That's why we call it HbA1c. The HbA1c will tell us the history, how much sugar was in our blood for 3 months to 120 days. That's the difference between the daily test and the HbA1c test during 3 months. Some people ask, shall we have this monthly? No, it's useless and waste of money. Why? Because the red cells will regenerate every 3 months, from 3 months to 120 days. Some people would like to be extra careful and really sure about the blood sugar reading. There is one instrument, one device, the person can put it in the arm. It has a small, very tiny, small needle. Even you can't feel it. It can be stuck here, can be used for 2 weeks, and it will give signal to your mobile phone. You can check every minute, every 10 minutes, every 1 hour, every half an hour, every 2 hours, after food, before food. And it also tell us 90 days overview, which can tell us how much cumulative sugar we have in our body.
Thank you, doctor. What does cumulative sugar have to do with obesity and high blood sugar complications and problems?
As I mentioned earlier, we have so many red cells. Now, the sugar stick to all the cells of the body, not only 1 or 2. And the body is running over all the organs, 24 hours, 7, non-stop. It goes to the kidney, and sugar will destroy these kidneys and start all the kind of kidney disease. It goes to the heart, same thing. It will start creating problem with our heart, our brain, also our eyesight, our eyes, the little nerves. Sugar will damage these nerves. Also, the nerves system. The sugar is really somehow destroy every small nerve in our body.
When should one have a HbA1c test? And is there any symptoms that a person's blood sugar is high?
Very good question. Very good question. You see, the problem with diabetes is that there is no problem. We can't feel anything until it's too late. When the problem becomes really too late, when we are affected in one of our organs, our nerves, our heart, our kidney, then we realize that we need to check. However, there are some signals the body will give telling us that be careful with your glucose level. One of them, if our waistline for men more than 105 cm, which is roughly around 40 inches, that is a problem. The body is telling us, be careful with your blood glucose level. You need to do something about it. You have to go and test. A lady or for women, if the waistline is more than 90 cm, that's a problem. It's a sign that we have or on the way to diabetes. If we feel hungry between meals, we just have lunch or breakfast, 1 or 2 hours later, we feel so hungry, we want to consume or eat something. That's a sign that we have high insulin and we might be on the way to diabetes. Frequent urination, that's a big issue. When we go every now and then 4 or 5 times at night to the toilet and pass urine, that is the problem, a big problem. If we have blurred vision, especially the long eyesight, the problem that we can't see far, that is a sign that we have high insulin or high glucose. If we have darkening of the skin and wrinkled areas, which we call it erytherosis nigricans, if you can see it here behind your neck, behind the knee, this is a sign that your blood sugar is really high. If you have itchy foot or itchy feet, either 1 foot or 2 feet, then there is a problem. It's a sign the body is telling us, check your blood sugar. If you feel fatigued most of the time, tired, little work, you feel really tired and you can't continue it, that is a sign. If you have a wound that is really healing very slow, meaning you have a problem with sugar. If you have any of these signs, the pancreas is telling us, you are giving me too much work. I am tired. Please help me control your food or do something about it. And by the way, the pancreas is the most neglected organ in the body. Normally we go and check heart, we check kidney, we check liver. Very seldom we find somebody go, please, I want to see how is the function of my pancreas. And these signs are telling us that you have diabetes or on the way to type 2 diabetes. Then the doctor will start giving you 1 medication, then 2, then 3, then 4, just like what happened with me. First, metformin, then Jardiance, then Tragintado, then Diamicron, or see which one first. Then the medication or the medicine will not give any results. Then you need to have insulin injections, 1 or 2 types, maybe start by 1, then another type, then 40, then the dose will be 40, 100, 200, it depends on your case. Some people will come and say, thank God, I don't have any of these symptoms. That's fine. However, are you 40 years of age? If you are, my advice, go please and check, because you will not notice until it's too late, until the diabetes is already with you. Why? Because as I said, this is the most neglected organ of our body from most people. And if it's got tired, ruins everything else. Our nervous system, our kidneys, our eyesight, our heart, everything will be ruined if we don't take care of our pancreas.
Thank you, doctor. What is the normal cumulative blood sugar reading?
Well, this is the chart behind me. You can see if the person HbA1c 5 to 6, that is excellent, wonderful, you don't have to worry. 7 to 8, that's the borderline, means you have to be extra cautious with your food, especially the carbs, sugar, fruit, etc. If it's 9 to 10, that is getting worse. Food restriction and medication is needed. 11 to 12, very high, extra medication and extra restriction with food. If 13 to 14, it's too dangerous, and you really need to control the amount of carbs and sugar that the person is taking. That's very dangerous. As long as you below 7, for me, I used to tell people, If you are 7, that's fine, but you have to know that you're on the way up if you continue having the same lifestyle that you have.
Good information. Thank you, doctor. What do you advise people in order to avoid insulin resistance and diabetes?
Thank you, Sarah. You know, most of our health problems are from wrong eating, when we eat the wrong food that we know sometimes, or we hear people say that it's bad for us, and we still continue to consume this kind of food. We have to be extra careful with what we eat. But are we? Majority of people are not. We eat burger, we eat this, we eat that, fried food, ready-made food, without thinking or without even checking what food are we putting in our stomach. That's why we have a lot of problems in our health. And 100 years ago, these kind of disease that we have right now used to be much, much less than now. Number of diabetics increased, high blood pressure increased, triglycerides increased, everything increased. Why? From our lifestyle. Our aim is to keep our blood sugar normal as possible. Supposed to be only 1 cube of sugar in our blood, but sometimes we found it's 20 grams of sugar in our blood, not only 5 or 6. To avoid also having a cholesterol and all the problems, high blood pressure, and not to gain weight, because gaining weight also is a problem, and it actually affects us psychologically and emotionally. My advice, please get rid of the sugar. Do not take sugar at all. You can do that. Take or consume less carbs as much as you can, and if possible, cut it completely, because this is what makes us sick. Sugar and carbs. Do not eat these fruits. There is a video about that in the channel. You can see these are really can raise blood sugar very, very high. Consume more of the vegetables. Don't worry about it. Practice some kind of exercise, heavy weight or any other thing, or at least jogging, or at least at the very least walking. And I'm asking you, just try for 2 weeks, 1 month, 3 months. You will see results. Your mood, the way you look, your feel, your energy, everything, you will find so much difference. Thank you for watching, and I hope this information is good enough, and I hope you enjoyed it, Sarah. Thank you so much.
Thank you, doctor. I hope you have benefit from the information in this video. And if you like this video, please share it so others may benefit as well. Thank you for watching, and see you in the next video.